Hi, this is Will from Maxfield Chiropractic. Today I'm going to talk to you about stretching your hip flexors. The hip flexor is quite an interesting muscle. It attaches from the front aspect of your spine, so it acts like a core muscle. And like the name suggests, being a hip flexor, it does attach into the proximal inner femur of your thigh, so it therefore can flex the hip, raise the knee up. So it has two jobs. So when it gets tight or weak, it's going to potentially affect the hip anatomy and the mechanics of the hip, but it's also potentially going to contribute towards back pain and alignment changes of the lower back. So stretching the hip flexors is definitely an important thing if it's something that you need to do. Now a lot of people will stretch the hip flexors by getting into this extreme lunging posture, and the lower back will start to overarch. Now, you don't really need to do that. Very simple. What we do is get into a slight lunge initial posture, soft knee. The lower back, now we want to try and just straighten the lower back. So I'm going to do what we call a posterior pelvic tilt. That's an anterior pelvic tilt. I'm overarching. I want to do the opposite. We're going to do a posterior pelvic tilt. Now in this position, just get a tall posture. We don't want to be slouched. Get a tall posture because it's going to bring the tension on. Get that posterior pelvic tilt coming, and the glute, I want you to contract the glute and just push the hips forwards. Now just feel the posture and feel the position. You'll start to develop a stretch through the front of the thigh, the top of the thigh into the lower abdominal area. If you're quite flexible, you might need to do either more of a posterior pelvic tilt and really try and contract the glute on this side, or you just want to go into a slight further lunge position. Once you've found it, you'll feel it develop very quickly, and keep that tension on the glute, keep the posture straight, and hold that stretch for about 20 to 30 seconds. Just back it off. Obviously do both sides. So again, nice and tall, contract the glute, posterior pelvic tilt, flatten the lower back, and just lunge forward slightly until you feel that stretch develop. Keep the glute tension on, keep trying to create that posterior pelvic tilt, keep tall, hold the position. If you're flexible, just lunge forwards a bit more, keeping the tension on, and hold the position for 20 to 30 seconds. Repeat both sides, and that's how you stretch your hip flexors without having to go into a full lunge posture. If you've got any problems, please get in touch.